Dialogues. I'm Mr. Zaman, and today I'll talk about Best of ESC Congress 2023. More than 30,000 health professionals from 175 countries attended this year's meeting, 24,000 on-site and 6,000 online. Novel findings were revealed in more than 3,750 abstracts and clinical cases presented by scientists from 86 countries. Practice-changing research was presented throughout the Congress with major new findings in the hotlines. The hotline program kicked off with STEP-HFpEF Next up was NOAH-AFNET 6, which showed that anticoagulants cause bleeding without preventing stroke in patients with atrial high-rate episodes or AHRE, but without electrocardiogram diagnosed atrial fibrillation. Rounding off hotline session 1 was COP-AF, a trial in patients undergoing major non-cardiac thoracic surgery, which found that colchicine does not significantly reduce perioperative atrial fibrillation or myocardial injury after non-cardiac surgery. Definitive conclusions about the role of iron therapy in iron deficient patients with heart failure and reduced ejection fraction were presented in the ferric carboxymaltose meta-analysis, which demonstrated a link with reduced hospitalization. Another important meta-analysis showed that intravascular imaging-guided percutaneous coronary intervention or PCI is associated with a lower rate of target lesion failure compared with angiography-guided PCI. New ESC guidelines were launched that will influence clinical practice across Europe and beyond. Professor John McMurray, ESC Congress Program Committee Chair, said, quote-unquote, 4 new guidelines were presented covering acute coronary syndromes, endocarditis, cardiovascular disease in diabetes and cardiomyopathies, the first guideline of its kind. A focused update on the 2021 heart failure guideline was also presented at ESC Congress, reflecting the tremendous and rapid progress in this condition even in just the past 2 years. Heart failure is both the cause and the consequence of the many conditions that are managed by CV health professionals and was the spotlight of this year's Congress. ESC Congress 2023 showcased a lot of extensive research. Some of those included weight loss medication benefits patients with heart failure and obesity or STEP-HFpEF trial, the first trial of a pharmacologic agent to specifically target obesity as a treatment strategy for heart failure with preserved ejection fraction, and indicating that obesity is a target for therapeutic intervention in this vulnerable patient group. Sedentary time in children linked with heart damage in young adulthood, which mentioned that hours of inactivity during childhood could be setting the stage for heart attacks and strokes later in life. Ambulances should take cardiac arrest victims to closest emergency department, which was a randomized trial involving all hospitals in London, UK, that found no difference in survival at 30 days in patients with resuscitated cardiac arrest in the community who were taken by ambulance to a cardiac arrest center compared with those delivered to the geographically closest emergency department. Keep fit to avoid heart rhythm disorder and stroke. In this study of more than 15,000 people, it was found that physical fitness is linked with a lower likelihood of developing atrial fibrillation and stroke. Smokers who start below age 20 become more addicted and find it difficult to quit. In the study, researchers urged governments to raise the legal age to purchase cigarettes to 22 years or higher, as the findings said that it becomes less addictive and easier to quit as people get older. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.